Heart disease, kidney problems, these are actually part of something called care me diseases. Can you please explain what it means and how it is important?
See, metabolic syndrome is like a mother of diabetes, also, heart attacks, also, kidney disease, also. So, the kidneys help the heart helps the kidneys, both regulate the metabolism. Any problem in any of these three things will result in a detrimental effect on the others.
There are more and more young patients who have kidney problem. Most common cause is undiagnosed diabetes and blood pressure for a long time.
You're not going with the proper exercises, you're not giving the proper sleep time, and obviously if you're having a very bad genetic history, you're going to bound to have the metabolic problems like diabetes very soon.
So, what are the early warning signs that a person can notice?
अगेन नॉन स्पेसिफिक सिम्टम्स होते हैं. आपकी थोड़ी सांस फूलेगी, आपको सर दर्द हो सकता है, आपको चिड़चिड़ापन हो सकता है, सर भारी रह सकता है, थकावट जल्दी हो सकती है.
यूरिन में कुछ चेंजेस महसूस कर सकते हैं, फ्रॉथ जाना, यूरिन का कलर चेंज होना, इवन इनफैक्ट यूरिन आप ज़्यादा जा सकते हो रात को. तो ये सारे सिम्टम्स ऐसे हैं कि जो बहुत नॉन स्पेसिफिक है, आप यहाँ पे मिस हो सकते हैं.
Diseases, heart disease, kidney disease and diabetes are rising in India.
सिंपल लाइफस्टाइल, सिंपल फूड, जैसे हिंदी में बोलते हैं सात्विक खाना, सात्विक जीवन शैली एंड सात्विक भोजन एंड ऑल दैट. द किडनीज.
Hello and welcome to this special podcast of Care Me Diseases. If you or you're someone that you love has high blood pressure, diabetes, heart problem or kidney problem, this episode is for you. We'll get to know about the Care Me diseases. This stands for cardiovascular, which is related to heart, renal, which is related to kidney, and metabolic related to diabetes or related problems. And we will discuss about and get to know that these diseases are not separate. These are actually connected and related. To help this understand better, we have three specialists with us. First is Dr. Ashit Khanna, who is a heart specialist, and Dr. Ravinder Singh Bhadoria, a kidney expert, and Amit Chabra, a diabetic and metabolism specialist. We'll start with knowing more about the Care Me diseases. What is this all about? So, doctor, many people think that heart disease, kidney problems, or related and diabetes are three different conditions of human, right? But these are actually part of something called Care Me diseases. So, can you please explain what it means and how it is important?
Right, because see, times are gone when diabetes just meant sugar control, heart just meant BP control, and kidney just meant control of proteinuria and management of blood pressure. We know that they are a complex web. The kidneys help the heart helps the kidneys, both regulate the metabolism. Any problem in any of these three things will result in a detrimental effect on the others. किडनी प्रॉब्लम्स हार्ट को खराब कर सकती हैं, हार्ट प्रॉब्लम्स मेटाबॉलिज्म खराब करता है, मेटाबॉलिज्म दोनों को खराब कर सकता है. इट्स अ कॉम्प्लेक्स वेब which we want to, through media and through people like yourself, simplify and demystify for our people.
That's a great point, doctor. Right. So we have Dr. Ravinder Singh Bhadoria. We'd like to know from your kidney perspective, right, how Care Me diseases impacts patients.
Definitely, as Dr. Ashit Khanna has said, it's very important aspect. It's all interconnected, and kidney plays a very important role as a filtration unit of blood. It removes the toxins. And mostly we are seeing patients who are diabetic and hypertensive. On long term, it impacts the kidney slowly, damage it. And once kidney problem starts, it also interacts with the heart and increase the risk of the cardiovascular complication, like more chances of heart attacks and strokes. So we have to see the wholesome so that we can give the care of the diabetes along with this heart protection and kidney protection.
Thank you, doctor. Dr. Amit, so from a metabolic perspective, these are actually the source of Care Me diseases, the diabetes if we talk about. So can you please highlight or point out how people should think about it?
In Care Me, if you see, the core disease is actually metabolic disease. Because once you talk about the metabolism related, it may be obesity also, it may be high blood glucose levels, abnormal lifestyle. So whatever changes your metabolism, it actually affects all the organs. Right. The major organs which we are actually worried about, the heart, kidney and related organs. So for that angle, we need to understand that whenever we have to think about diabetes or metabolic problem, we have to take care overall, holistically. Nowadays, we don't give medicine for only blood glucose in keeping in view. We give medicine thinking that we have to control and protect that heart and the kidneys also altogether. For that reason, this Care Me program is actually there. Care Me means cardiac, renal, and metabolic are actually together, not separate.
Thank you, doctor. So, doctor, we keep hearing that these diseases, heart disease, kidney disease, and diabetes are rising in India. But how this big is this problem really is, right? So, if you can please share some insights on how it's creating burden to the society, like this Care Me diseases.
See, it has always been a big problem in India. Previously, we did not know about it because there wasn't enough data collection. Since the times when data collection has started, we are acknowledging or realizing that the problem is increasing by leaps and bounds. It is increasing at a rate which is much faster than the West. There are multifold reasons for that. Most important reason is a rapidly changing lifestyle. We are westernizing very fast. On one hand, we are westernizing fast, and on the other hand, we are losing our traditional Indian and relatively simple lifestyle, simple food. जैसे हिंदी में बोलते हैं सात्विक खाना, सात्विक जीवन शैली and सात्विक भोजन and all that.
Right.
And rapidly taking up the bad habits of the West. That is on one hand. The other is, as Indians, our genetic phenotype and genotype is not suited for those kind of these lifestyles. They may digest better and larger amounts of alcohol than we. So we are aping those lifestyles. Third, our environment pollution, water pollution, air pollution, stress levels, abnormal lifestyles in the form of call center jobs, which are playing havoc with our hormones. So there are multiple fronts in which we are being attacked, Indians especially. Mm-hmm. For that reason, the disease progression of diabetes, hypertension and metabolic diseases are increasing at a much faster rate than the Western population. They never had that good lifestyle. जो Indians का हमारे था सात्विक जीवन and all that, वो उनका था ही नहीं. But we are rapidly losing one good thing and adapting to a bad thing very fast. And in a pool in which we are not at all, built for that kind of a situation.
Thank you, doctor. Dr. Ravinder, we'd like to know how this is impacting in your clinical practice.
Definitely, as Dr. Ashit Khanna has told us, it's growing rapidly. And now you can say India is the capital of the diabetes. There are more and more young patients who have kidney problem. Most common cause is undiagnosed diabetes and blood pressure for a long time. If diagnosed also on time, they don't keep control of blood pressure and blood sugar. That's why they'll end up into the kidney problem. And at very early stage, it is asymptomatic. Patient को कोई symptoms ही नहीं आते जब तक at least 80% of the kidney already damage हो चुकी होती है. So we have to address at very early stage. That's very important by Care Me program.
Thank you, doctor. So, Dr. Amit, are these cases are also increasing in younger people as well?
Yes, it's increasing at very fastest rate. You will be surprised that normally we see that type 2 diabetes, जहाँ पे इंसुलिन रेजिस्टेंस बढ़ जाता है, जिनको इंसुलिन की ज़रूरत नहीं होती, टैबलेट से ठीक हो जाते हैं. These people usually comes after 40 years, a decade back. But nowadays we see that the younger population, 15 years, 18 years, obese kids and child are coming up with a high blood sugar. And we see these numbers are increasing day by day in OPD. And the reason is very clear that if your metabolism is not okay just because you are not keeping with the diet time, you are not going with the proper exercises, you are not giving the proper sleep time, and obviously if you are having a very bad genetic history, you are going to bound to have the metabolic problems like diabetes very soon. So it's a very alarming. So I think with this sensitization of Care Me program, it will be highlighted that not only the blood glucose you are going to control, you are also protecting your organs, which is actually very important for the very healthy lifestyle.
Thank you, doctor. Now that we understand what these Care Me diseases are, now we'll talk about more on what are the early symptoms and signs that you can notice to identify these kind of issues or treat problems that is arising in day-to-day life, right? So, Dr. Asit, so many people ignore health issues until it really becomes serious, right? So, what are the early warning signs that person can notice to identify these kind of issues?
Right. So first thing, please remember, never ever wait for symptoms and signs. All three of us sitting here, हमारी जो diseases हैं उसमें कोई भी symptoms and signs नहीं होते. Neither cardiac, neither kidney, neither metabolic.
Right.
Once you have symptoms, it's already too late. As Dr. Bhadoria said, by the time you start getting kidney symptoms, your kidneys are 80% gone. But as you said, what are the symptoms to look out for? Okay, so let's start with blood pressure. Blood pressure again non-specific symptoms होते हैं. आपकी थोड़ी सांस फूलेगी, आपको सर दर्द हो सकता है, आपको चिड़चिड़ापन हो सकता है, सिर भारी रह सकता है, थकावट जल्दी हो सकती है, सीढ़ी चढ़ने में सांस फूल सकती है, बॉडी एक्स एंड पेन्स इन जनरल, रात में नींद ना आना, नाइट मेयर्स आना, सुबह चिड़चिड़े उठना. सो वेरी वेग एंड वेरी नॉन स्पेसिफिक सिम्टम्स आपके बीपी के होते हैं. अनलेस आपका बीपी इतना बढ़ जाए लाइक 200 220 एंड यू गेट अ स्ट्रोक और यू गेट अ हार्ट अटैक और यू गेट ब्लाइंडनेस इन वन आई और सडनली वन किडनी इज गॉन, वो तो बहुत लेट स्टेज होती है. सो नेवर डिपेंड ऑन सिम्टम्स. सेकंड, नेवर लुक फॉर स्पेसिफिक सिम्टम्स. अगर आपको हल्के से भी नॉन स्पेसिफिक से वेग से सिम्टम्स है, जो मैंने अभी सिम्टम्स गिनाए, ये सिम्टम्स शुगर के, डायबिटीज़ के भी होते हैं, मेटाबॉलिक डिसऑर्डर्स के भी होते हैं, यही सिम्टम्स किडनी के भी हो सकते हैं, बारिंग अ फ्यू स्पेसिफिक सिम्टम्स. डायबिटीज़, अब डायबिटीज़ के क्या सिम्टम्स होते हैं? कोई सिम्टम्स नहीं होते. अगर आपको भूख ज़्यादा लग रही है, प्यास ज़्यादा लग रही है, पेशाब ज़्यादा हो रहा है और आप भूख ज़्यादा खाने के बाद भी दुबले होते जा रहे हो, आप पतले होते जा रहे हैं, आपको थकावट रहती है, दीज आर द वेक सिम्टम्स ऑफ शुगर. बट ये तो कितने लोगों को कॉमनली होता है, नॉर्मली होता है, इसके लिए कभी भी इंतजार नहीं करना है. बट ऑफ कोर्स इफ़ यू हैव दीज सिम्टम्स, इमीडिएटली रश टू योर डॉक्टर, बिकॉज यू कैन बी वेरी श्योर दैट अभी ऑलरेडी लेट हो चुका है. नेवर वेट फॉर सिम्टम्स. वेगेस्ट एंड स्लाइटेस्ट ऑफ सिम्टम्स में रियलाइज़ की अभी बहुत ज़्यादा एडवांस हो चुकी, बिकॉज वी आर नॉट टॉकिंग, जैसे डॉक्टर अमित ने बताया, हम लोग शुगर के लिए, शुगर डायबिटीज़ के लिए शुगर की दवा नहीं देते. अब हम तो शुगर प्रिवेंशन की बात कर रहे हैं और अब शुगर के रिस्क फैक्टर्स के प्रिवेंशन की बात करते हैं. इसके लिए हम यहाँ आज बैठे हैं. व्हाट इज कॉल्ड एज प्राइमोर्डियल प्रिवेंशन. हम उसके रिस्क फैक्टर्स को भी नहीं आना देना चाहते.
Thank you, doctor. Okay, Dr. Ravinder, since these kidney diseases, right, don't always have symptoms, so what people should watch out for?
ऑलरेडी सर ने बताया कि इट इज़ वेरी वेग सिम्टम्स होते हैं. अनलेस कि 80% किडनी जब तक डैमेज होती है, काफ़ी कुछ चीज़ें पता ही नहीं चलती हैं, सडनली ये सब चीज़ें सिम्टम्स आते हैं, तो वी शुड नॉट वेट फॉर सिम्टम्स. अर्ली सिम्टम्स ऑफ वेग हो सकते हैं, थकावट होना, भूख नहीं लगना, नोजिया लगना, स्वेलिंग आना चेहरे पे और पैरों पे, यूरिन में कुछ चेंजेस महसूस कर सकते हैं, फ्रॉथ जाना, यूरिन का कलर चेंज होना, इवन इनफैक्ट यूरिन आप ज़्यादा जा सकते हो रात को. तो ये सारे सिम्टम्स ऐसे हैं कि जो बहुत नॉन स्पेसिफिक हैं, आप यहाँ पे मिस हो सकते हैं. तो अगर आपको डायबिटीज़ और हाइपरटेंशन है, you have to definitely should keep in touch with the doctor. They will advise you proper tests so that we can come to early diagnosis and we can prevent this as further as we can do.
Thank you, doctor. So we have Dr. Amit, we would like to know how someone can identify that they are developing diabetes in themselves.
Dr. Asif has already explained that the symptoms which we normally talk, excessive urination, excessive appetite, weight loss, this comes once you've already gone through the stage beyond, you can say, normalcy. Means once you're going to attract a lot of complications. We are talking about the early symptoms. The early symptoms is actually seen in only 5 to 10% or maybe 20%, not more than that. If you talk about 80%, I will say everyone should go for a screening of blood sugar or blood glucose levels once they cross the age of 20-25. And if there is a strong genetic history, the early you start the checking, it's very good. But yes, if you're really talking about the person which we don't know having a diabetes for last so many years or months, then the weight loss, very high appetite, or you can say frequent urination, the major symptom they usually come with. But sometimes they usually come with a lot of complication also. We see that patients are coming with a sudden blindness. The retina is gone because of the glucose, they didn't check it on time, or they come up with the borderline kidney problem, or they're already having the cardiac problem like heart failure, or maybe sometime they had an early, you can say, occult heart attack also, which he may not be able to understand on time. So these issues can come up along with the first timer we diagnose diabetes.
Thank you, doctor. That's a great response. Since now we have talked about these are the symptoms that doctors all discussed about, right? Now we'll talk about how the treatment looks like. We discussed what is this care-me diseases are and what are the symptoms that you can identify. Now let's talk about what are the treatment will look like. So Dr. Asif, we'd like to understand that how this effective care-me treatment will look like.
Right. So The Care Me program has been started to make sure that you start identifying the diseases early, start identifying the risk factors for those diseases early, and try to prevent those risk factors from developing so that you don't develop the disease. We are going into primary prevention and primordial prevention. When you do not have any risk factors, you are absolutely healthy, you don't have any family history, that is the best time to start getting yourself checked up. See, metabolic syndrome is like the mother of diabetes also, heart attacks also, kidney disease also. So मेटाबॉलिक सिंड्रोम क्या है, मेटाबॉलिक डिजीजेस क्या है? मेटाबॉलिक सिंड्रोम में अगर आप हल्के से मोटे हैं, आपका ट्राइग्लिसराइड्स हो ज़्यादा है, आपका वेस्ट सर्कमफ्रेंस ज़्यादा है, आपकी फास्टिंग ग्लूकोज इम्पेयर्ड है, थोड़ी सी ग्लूकोज ज़्यादा है, आपका थोड़ा सा बीपी ज़्यादा है, दीज आर अ मिक्स अ पॉट पुई ऑफ मेटाबॉलिक सिंड्रोम. अब ये दिस जो मैंने अभी चीज़ें गिनाई है ऑलमोस्ट 80% पॉपुलेशन में है. किसी का वेस्ट कम ज़्यादा है, किसी का फास्टिंग ग्लूकोज बॉर्डर लाइन पहुँच गया, बीपी बॉर्डर लाइन पहुँच गया, ट्राइग्लिसराइड बॉर्डर लाइन पहुँच गए, वेट बॉर्डर लाइन पहुँच गया, स्मोकिंग करता है, फैमिली हिस्ट्री. सो वी मोस्ट ऑफ अस आर इन मेटाबॉलिक सिंड्रोम ऑलरेडी.
Right.
So we are already planting the seeds for heart disease and kidney disease and strokes and blindness.
Correct.
So treatment begins with prevention. So we are emphasizing on prevention. Care Me is emphasizes on prevention. कोई बात नहीं, you have crossed it, now you are into the disease. So we treat the disease. Gone are the days when we say कि हमें disease के complications treat करने हैं, like heart failure, dialysis, and blindness or strokes. हमें वहाँ पे जाने ही नहीं देना आप लोग को. We don't want the population to come with us those complications. We want you to come to us early and say कि मैं बिल्कुल ठीक हूँ और मुझे ठीक रहना है, उसके लिए बताओ क्या करना है. So we identify you with blood checkups and fundus examinations and pulse examinations and neurological examinations and urine examination, blood examination, that you are at risk for such. So prevention is the first treatment. Suppose you get BP, you start treatment for BP as soon as possible. Never change it, never stop it, never withdraw medicines on your own. Same for diabetes, same for kidney disease, same for cholesterol. These are lifestyle diseases. Once you are in it, you are in it for life. Those medicines mostly never go away. Specifically, you can talk about kidney diseases, you can talk metabolic diseases, but the crux is the same.
Understood. Thank you, doctor. So, Dr. Ravinder, how this how we can protect kidneys with these kind of issues?
Already explained by sir. We have to take care of good control of blood sugar and blood pressure. Along with this, we have to adapt healthy habits, like we should do regular exercise, we have to control our diet, have a proper sleep, and you should stop smoking. Alcohol should be avoided if it is possible. And most important, regularly you have to check your blood sugar along with this blood pressure, and definitely all blood routine checkup, so that we can come to know any organ damage at very early stage. That's more important.
Thank you, doctor. Dr. Amit, we'd like to know how we can control diabetes that should not affect your kidney and heart as well, right?
Yeah, I think this is a very important question. Earlier, if you asked me this question 10 years back,
right,
I would have told you that take a very anti-hyperglycemic medication, which were actually very less in number, and they were more focusing on blood glucose control. But nowadays, that this Care Me program is just because of that part. The newer medication, which we normally start with, are actually focusing on the protection of the kidney, hearts, and other organs also. So our main purpose is first to evaluate the patient, that how far a person actually requires a major protection. Let's suppose patient may be already going through the cardiac related issues or having a lot of risk factors, or maybe the renal risk factor. We will focus more towards those medications which actually can protect in further in due course with the treatment. So presently, I will just try to focus and say also that these days we are having newer generation medicines, like which we call it as SGLT2 inhibitors, we call it GLP-1 receptor agonists, DPP-4 inhibitors, metformin. This is actually the name of, the group of the name of the medicine which present day physician used to start with. But sometimes even I see that the doctors who are actually in the peripheries, or they don't have very good knowledge, they may start with even the older days medication, which they don't actually protect your organs.
Yes.
So always I would say to everyone that whenever you go to see your doctor, always ask that are these medications are going to protect us from the other organs like kidneys and the renals or cardiac related issues, periphery and the vascular related issues or not. If it actually helps, then they are definitely the medication which we usually or we should prescribe.
Right.
So that's the one thing. And the another point I would like to say that whenever we going to start medication for the diabetes, it doesn't mean that you need to be on diabetes medication throughout the life.
Right.
Even these days you're working on, if you improve your lifestyle, in 50% scenario of early diabetes, they can delay it,
Right.
or you can say a year or two, or you can reduce medications by even 50%. But if you will not control that part initially, because that will last for the longer term also in terms of complications also. If you don't control diabetes or blood glucose initially, you are bound to have a lot of complication in years to come. So
Right.
early treatment is very, very important. So don't ignore it and don't delay it, whether in terms of the treatment, screening, or whatever way you can manage your care, me type, all the three organs together.
Thank you, Dr. Amit, for your valuable advice. Now we understand what is the scare me disease is, what are the symptoms are there, and how we treat from our experts. Now, Dr. Asit, we'd like to see if you can give some advice, advice to our audience on care me diseases.
I'll just summarize it a little bit in the sense that look at the risk factors for these diseases. Get them regularly checked up, even if it requires a lot of time and to some extent money. Go for the risk factors, as Dr. Baduria said. If you smoke, don't smoke. If you take alcohol, don't take alcohol. WHO clearly says any amount of alcohol is bad for health. So that 1 peg, 2 peg thing, no, that chalta hai, that doesn't, nahi chalta hai. If you are overweight or obese, slim down, you have more fat, you should get your fat analysis done, that how much is muscle, how much is fat. So we are not in those era where we just used to look at weight as a measure of obesity. Obesity definition has changed. You have to get your body percentage of fat analyzed.
Correct.
And now, as Dr. Amit has said, we have SGLT2 and GLP-1 receptor agonists, which will reduce your body fat, not reduce your muscle mass. So you may become lean, thin, with more muscle, less fat. So we are going much, much finer. We don't look at BP anymore. We don't look at just fasting sugar, PP sugar and HbA1c. We're looking at time in range of sugar over years. We're looking at continuous glucose monitors. We're looking at much finer. We are looking at devices which monitor our kidney health. We're looking at artificial kidneys. We are looking at a huge, brave new world which starts right from the prevention of the risk factors for diseases to the treatment of the treatment complications. Everything is there. Patient awareness is key. That is what Care Me stands for. That wherever stage of your illness you are in, risk factor development to end stage kidney disease, end stage heart disease, end stage metabolic diseases, we are there for you, and we emphasize that you get yourself checked up at every stage and stay in touch with your doctor and don't play with your health. That's very important.
Thank you, Doctor. Dr. Ravinder, can you please also give some advice to our audience?
Yes, definitely. From kidney perspective, I would like to say regular screening is very important, especially for diabetes and hypertension patient. They should look for the urine for albumin presence, protein presence, and a kidney function test. Look for the GFR. And if needed, ultrasound also, because kidney disease can't be diagnosed without any test. So if you have diabetes and hypertension, you need to cross-check these blood tests regularly at once in 6 months. If there is a kidney problem, definitely you have to remain in touch with your doctor, and you have to follow his every advice. No need to stop medicine by your own. Don't take any unnecessary medication, especially painkillers. Don't take any Ayurvedic medication because they doesn't show any beneficial effect, because patient they usually go for the alternative medicines and they don't follow the patient doctor's advice, and diabetic kidney problem very fast. They end up into dialysis very soon. So once they start developing kidney problem, they have to be very careful. They have to be keep in touch with the doctor. Doctor will guide you properly on timely how it can be managed properly.
Thank you, Doctor. Dr. Amit, from diabetic and the metabolic issues, can you please share your advice as well?
I will say that whenever you should focus on your metabolic part, first of all, try to check the blood glucose every yearly, possible once you cross the age of 25 to 30 years. Try to have the keeping in mind that if your family history is very strong, like you are having a lot of people in the family having diabetes or having history of cardiac related issues or renal related issues, you should try to check the risk factor like blood glucose very frequently. And once you got to know that you are in an early phase of the blood glucose high levels, then don't ignore it. Try to touch with your doctor as early as possible so that we can control not only blood glucose, keeping in mind that this blood glucose levels high is not actually making you diabetic, actually making prone for your damage for kidneys and the heart in a long run also.
Right.
So always reach your doctor early and try to control it.
That's wonderful. Thanks, doctors, for your wonderful advice and for our audience. Your health is in your hand, and please focus on your future and take every advice step by step, implement in your daily life, and that's how you can protect your future as well. See you next time. Thank you.